Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Meera Medical Institute of Nursing and Hospital, Abohar. So today, I am going to explain you about the topic that is minor ailments, and today I will explain only about the part one. So this topic will be explained in different parts. So today, today's topic will be the part one. Okay. So I have chosen this topic because it is very important and it can be asked in the exams, final examinations of the BSc fourth year, post basic second year, or GNM classes. So under the 5 marks, or it may be if the management of the different types of minor ailments are asked, and it can be under the 15 or 7.5 mark. Okay, so let's start with the topic minor ailments. Okay, so topic is minor ailments. So as you can see, so today I am explaining from a PDF, not from the PowerPoint. Okay, so a complete notes of this topic will be available on this video. So you can take the screenshot and get a printout of that. Okay. Next one is the minor ailments. So first of all is the introduction. So the introduction include that minor ailments are some minor types of infection or diseases, we can say, which we normally, which affects us normally in our home or in different situations, like for example, headache, fever, nausea. Okay, mild types of burns, drowning, and earache, toothache. So these are some of the examples of the minor ailments. So these are the examples, or these are some of the ailments that I will explain you later. So as per the book or the notes, they are defining it as minor ailments indicate slight illness. It also includes emergencies of the small nature. Sometimes illness may be acute, which may need immediate care, or it may be chronic, or which requires long treatment and continuous supervision. Okay, so what is minor ailment? Is a slight illness. It can be acute, it can be chronic. Sometimes it may be dealt for longer duration. That if it is not maintained for some time, it's not going to be any type of problem. There is not any type of problem. But if it is chronic, then you have to refer to the doctor. Okay, so that is what we mean by the term minor ailments. Okay, community health nurse. Second, in the second paragraph, it is written here is community health nurse is responsible to provide primary health care in the community, and the treatment of minor ailments and managing the emergencies is one of the components of the primary health care. Okay, so what basically a community health nurse do in during the home visits is that she always tries to manage these types of ailments, because in the community areas normally people are suffering from the different types of minor ailments. Okay, so each and every, or everyone from the family can have these type of ailments, or which may be acute or chronic depending upon the situation. You have to manage that. If the minor ailment is acute, then it can be managed by the nurse, or if in case it is chronic, then you have to, the nurse will advise that family member that they should contact with the doctor, or the nurse would refer that specific patient to the doctor or the PSCs. Okay. Next is about 80% of the minor ailments are treated by the nurse. Okay. So from 100%, 80% of the minor ailments, its treatment is done by the nurse. Okay. The nurse has to treat minor ailments, but according to the abilities and standing orders. So the second term in today's lecture would be the standing orders. What are standing orders and how these are able to manage the different types of minor ailments? I will explain you later. Okay. So second thing in this is, what are the principles of managing minor ailments? So there are different principles by which we can manage the minor ailments, or we have to kept these principles in mind when we are treating the minor ailments. So first of all is ensure a safe and helpful environment for the patient. If For example, a patient is suffering from the minor ailments, just provide him or her with a healthful environment. Okay, so that is the first principle. Second one is the treat the risk or the injured person promptly or immediately to prevent any complications. So if there is the presence of any injury or it would not lead to any type of complication, so its treatment should be immediately done. Third point is in case of infections or communicable diseases, take appropriate precautions to prevent spread of infection. So it is obvious that when the specific minor ailment is related with the transmission of it is a communicable infection or disease, then immediately precautions should be taken. For example, the person who is suffering from that type of minor ailment that must be communicable to the another person, he or she must be isolated, or his clothes should be we can say that should be arranged from in the different almirahs, okay, and he or she should be isolated from the rest of the family members so that the disease would not be able to spread out. Okay. Next, fourth point is during entire period of care, keep continuous watch over the patient's conditions and the vital signs. So we are treating the minor ailments, but the thing is we have to keep a continuous watch over the vital signs or the conditions, because um, if for instance, if we talk about the minor ailments, uh, in some time within some time, sometimes the minor ailments gets converted into the chronic ones, so we have to keep a close watch. Okay. Next, help the patient to get well as soon as possible and his activities of daily living. So we are treating the minor ailments, so we should try our best, the nurse should try her best, so that the patient should not be depending upon any of the persons. So immediately the care or the treatment should be provided so that the person must revert back to its normal state and can do his activities of daily living by himself or herself. Next, use the opportunities of the health education during the care. So each and every time, not the nurse will not be available each and every time. So some of the basic things that are required to manage the we can say that the minor ailments, must be or should be taught by the nurse, the different family members. So in the absence of the nurse, they should be able to manage themselves. Okay. So health education must be provided. Next is always remember the limitations in providing treatment or follow the physician's instructions. Okay. So uh, what are the limitations that a nurse has to follow, that up to what extent he or she can provide the care to the patient, or up from which instance there is a need of the doctor should be having the close watch. Okay. Next, help the family members in coping with the situation and prepare them for taking care of the sick at home. Okay. So family members, the nurse or the health professional must be uh, help the family members in coping or coordinate with the family members effectively, and must taught the other family members that how they have to provide care to the sick person. Next, respect the beliefs of the patient. It is the basic principle in each and every we can say that the procedure or the topic of the community when we are providing the domiciliary care, that we should respect the beliefs of the patient and we should not make any fun of their beliefs or the cultural values or the religious values. And if he has used some other therapy for the treatment of his treatment. So if apart from the allopathy, if the person or the sick person or the family members has advised the patient, that he or she is using any other type of medicine system, so we don't have to make any fun of their decision. Okay, so it should be kept in mind. And last is in case of the serious conditions or doubt about diagnosis and prognosis, refer the patient without any delay. So if the nurse would think that the condition is going to be worsened, then it should be immediately referred to the hospital or to the specific doctor or the specialist. Okay, so these are the principles of the managing minor ailments. Okay, next one is the so these are the principles. Next is the classification of the minor ailments. So how we classify the different types of minor ailments. So there are different categories, and by the name of this category, we classify these. So first of all is the general minor ailments. It includes common accidents and emergencies which need immediate care or first aid. So in the general minor ailments, there is no specific, we can say that that disease or the infection, but we are including several of them, and which requires immediate treatment. For example, the falls, fractures, burns, dog bite, high fever, heat stroke, diarrhea, fainting, etc. can be included. So these are some of the examples that we can include in the general minor ailments. Okay. Next, second one is the systematic minor ailments. So as the name indicates, it should be, or it is including the specific organ or the organ system. For example, first is the eye. Accidental injury in the eye, foreign bodies in the eye, infection, poor eyesight, dry eyes, night blindness, etc. So these are the minor ailments relating with the eye. Next one is the ear. Okay. Next one is the ear. So what includes in the ear is earache, that is pain in the ear, foreign body in the ear, that is any type of mosquito or any type of other vector, but that just media discharged from the ear, and okay, temporary deafness. So these are some of the things, some of the, you can say that the infections, and so some of the infections that are included under the ear. Next is the respiratory tract. So allergic rhinitis, common cold, sinusitis, sore throat, cough, dyspnea, chest pain, asthmatic attacks. So these are the examples of the infections of the minor ailments that are included in the respiratory tract. It includes other also. Next is the cardiovascular system. It includes hypertension, anemia, rheumatic heart disease, etc. Next is the digestive system. So from the oral cavity to the anus. So this is all about the digestive system. So each and every infection of the minor ailment will be included to each part. For example, the toothache, that is pain in the teeth, stomatitis, that is the inflammation of the oral cavity, and soreness in the mouth, diarrhea, indigestion, vomiting, abdominal distension and pain, intestinal obstruction, and hemorrhoids. So this is these are the examples of the different types of minor ailments under digestive system. Okay. Next is the urinary system. Burning micturition, that is pain during urination, retention of the urine, urinary infection, renal stones. Next is the neuromuscular system. It includes the headache, backache, convulsions, epileptic fits, etc. Next one is the reproductive, and what it includes is dysmenorrhea, heavy bleeding, sores and discharge from genitals and breast lump, etc. So this is how we classify the minor ailments. Okay. Next is management as per standing orders. So how we would manage the minor ailments? What are the various standing orders, or what is standing order? So first of all is the definition of the introduction. Standing orders are the specific instructions, directions, and the orders of the specific nature the nurses and the health workers can use to provide treatment in emergency situation, patients at home, hospital or health institution, or in community. For example, what is standing order is, for example, the doctor is not available, but there is an emergency and nurse has to manage, and nurse is the only person available. So the doctor, in the absence of the doctor, nurse can work on the standing orders that she can do the first aid or prescribe any type of things that are required during that emergency situation. Okay, so this is what we mean by the term standing orders. Generally, these instructions orders are in written form. Still, in some medical institutions and health enterprises, standing orders are followed as tradition. So mostly they are in written form. Okay. It is appropriate to follow standing instruction only on the temporary basis or in cases of the emergency or when doctor is absent. So mostly standing orders are used in the situation when the doctor is not available. Okay. So that was about the standing orders. Next, we will talk about the what are the various objectives of the standing orders. First of all is that to maintain the continuity of the treatment of the patient. So it is obvious that when the doctor is not available, then the treatment can be stand still. So for the continuation of the treatment, nurse has to be delegate the power or the power or the decision making that she or she can continue with the treatment. Okay, so for the continuity of the treatment, second one is to protect the life of the patient, to resuscitate him in case of emergency. So when we are continuing with the care, or for example, if the standing order is not there, the nurse cannot do anything. So he or she have to wait for the doctor. So in that situation, standing order will help in the continuation of the treatment, and that will able to resuscitate the patient and protect the life of the patient. And third one is to create the feeling of the responsibility in the members of the health team. Okay, so if, for example, the nurse is working on the standing order, she will be acting as a team leader, or in the absence of the doctor, he or she have also have to do the perform the duties of the doctor. Okay, so there will be the sense of or the feeling of the responsibility. Next is what are the uses. Okay, so what are the various uses of standing orders? Provide treatment during emergency. I have already explained. Enhance the quality and activity of the health services. Doctor is not available, but the nurse is providing the treatment, so that will enhance the quality. That means there will be the continuity of the treatment. All the services would be able to provide to the patient. Third one is the strengthen primary health center care activities in the community. So it is obvious that when we are performing or we are providing the care, okay, so it will also help to the strengthen the health care services in the community. Next, decentralize the health responsibilities. There are two terms always I am talking about, that one is the centralization and second is the decentralization. In centralization, there is a single person who will give the command, but in the standing orders, the doctor will delegate his responsibility to the staff nurse or the nurse on duty, and so he or she can take the decisions. Okay, so there is the decentralization of the responsibilities. Next is develop the feeling of the confidence and responsibilities in the nurse and other health workers. So it is already explained. Next is to protect the general public from the quacks. So quacks are the persons or I would say that the non-professionals who are not having any type of degree. Okay, so for to safeguard them from these type of quacks, standing orders work in an effective manner. Last one is enhance the faith of the general public in medical institutions, community health services. So when there is the continuity of the services, that means there will not be any type of breakage in the providence of the healthcare services. So it will give a very good message to the public, and they will be interested in receiving the care from the various medical institutions or community or in the providence of the services. Okay, so these are the uses of the standing orders. Next, what are the types of standing orders? Yeah. So what are the various, I would say that the types of standing orders? The authorized doctor and the registered nurse or a committee with the nurse representative in it jointly release standing orders. Okay. So there is a team that will deal with the standing orders. Okay. So it includes a doctor, a nurse, and a representative. Okay. So there are three categories of the standing orders. First of all is the institutional standing orders or the instructions. Second one is the specific standing order, and third one is the general standing orders. Okay, so as the name indicates, it is like that. First of all is the institutional standing orders or instructions. In this category, standing orders are prepared with the view of available resources, staff position, and objective of the medical institution or hospital. So institutional standing orders are what they are is that they are made based on the what type of the resources of the staff is available in that institution and what type of care has to be provided to the patient. Okay, for example, standing orders of the primary health centers can be different from of the district hospital, or so it depends upon the type of the institution. So it is this is the reason why these are known as the institutional standing orders. Okay, next second one is the specific standing order. So what is specific standing orders? These type of standing orders are prepared for the trained medical personnel, mainly for the nurses. Technical knowledge and special skills are required to implement these orders. Okay, so specific means to say we have to specify the person, and mostly the person is the nurse. For example, giving injection of season, home nursing, etc., come under this category. Okay, so for this we are delegating a single person, and that is nurse. So these are the specific standing orders. Next is the general standing orders. Due to large geographical area and population and shortage of the health resources, some standing orders are used to propagate the health message to the masses. So when there is no specific health professional available, then general standing orders are used in that place. Common man is expected to follow these standing orders or the instructions. So in this, common man is the person who will follow the standing orders. Okay, such standing orders or instruction include taking tablets of the quinine in case of fever. So this type of standing order is for the mass level of the population, in which the community member himself or herself will join these standing orders. Potrimexazole for pneumonia, and advice to drink ORS in case of dehydration. Okay, so that is what we mean by the term general standing order, and these were the different types of standing orders. Next, a paragraph here is written here, that is need for the standing order. In short, I will explain you about that. So obviously, I will not read all the lines, but I will give you a conclusion that what this paragraph is about. What is the need of the standing order? So I have already explained that if in case a doctor is not available, or there is the risk that there will be the discontinuity in the treatment for as the doctor is not available, so other type of professional that is skilled enough and knowledgeable enough that he or she can continue with the treatment, so they are delegated to provide or prescribe the treatment to the patient. So this is the main point, that why standing orders have importance, or why they are needed, that for the continuity of the patient care. And second thing, if there is a continuity of the care, then we can be able to make the patient survival easy, and we can save the life of the patient. So that is the conclusion of this paragraph. Okay. Next one is the standing orders for the treatment of minor ailments. So this is the main topic. Okay. So standing orders for the treatment of the minor ailments. So firstly, I am starting with the acute cases. So there is a category of the minor ailments. Not all the minor, I will not explain all the minor ailments today. So 2 to 3 minor ailments I will explain today, because I have included the topic of the standing orders in today's topic. In the next topic, I will explain you about the different types of the minor ailments and how they have to be managed. Okay. So first of all, today's minor ailments is acute cases. Under the acute cases is the most common thing and the first sign and symptom of every disease or infection, that is fever. And in bracket it is written here as elevated body temperature. Okay, so how we have to manage this is, firstly, check the vital signs. That includes temperature, pulse, respiration, blood pressure, fever above 98.4 degree Fahrenheit, and pulse not normal. So we have to assess this if we have to assess for the fever. Secondly, find out other associated signs and symptoms accompanying the fever. To ascertain the cause of the fever, like headache, uneasiness, nausea, vomiting, shivering, chills, running nose, allergy, skin infection, jaundice, fits, cough, abdominal pain, etc. So normal fever is, it's okay, but if is I'm not saying that the person should get fever, that is not okay. But if the person is only suffering from the fever, mild fever, there's there is nothing risky. But if it is including different types of for example, the symptoms like I have explained, that nausea, vomiting, shivering, chill, so that can give a message that the person might be suffering from any other type of the dangerous disease like malaria, typhoid, chikungunya, or any other type of thing. Okay, so that is what we have to look for. Next, third is the observe for the skin. Observe for skin rashes indicative of the communicable disease, that is measles. So measles, the sign and symptom is skin rashes. So we have to observe if they are present with the fever. Next is advise the pet tests that have to be done. Next is advise the patient to take light meal and plenty of oral fluids like juice, rice. So if the person is suffering from the fever, okay, so he or she should be advised to take the light meal, semi-solid or the liquid type. Next, and proper ventilation by opening the doors and windows in the summer. Next is prepare blood slide to examine the malaria parasite. So if there is shivering, headache, and fever is present, so that can indicate the presence of the malaria. So we have to do the malaria parasite test. Okay, so we have to take the blood smear or and get it checked for the presence of malaria. Okay, next is administer antibiotics to bring down the fever. So how we can manage is that we have to give the antibiotics so that uh, we can treat the fever. Next is if fever is more than 39 degrees centigrade, that is 102.2 degree Fahrenheit, apply cold compress to the forehead. So by the use of the wet bandage or the wet cloth, we have to we can say that decrease the temperature of the body. Next, monitor the pattern of the fever and wait for the 2 days. So provide this care or follow these steps for 2 days. But if after 2 days the fever is still in a constant manner, it is increasing or is stable, then immediately refer or get an appointment with the doctor, so that there might be the possibility that the patient must be having some other type of disease that can also be moderate or the chronic one. Next, in case of delirium, convulsion, unconsciousness, and hyperpyrexia, that are the symptoms of the chronic disease accompanying the fever, refer the patient to the doctor immediately. Okay, so that was about the fever, that how we can manage the fever. Second one is the sore throat, and that will be last for the 2 days lecture. Okay, that is sore throat. Next is it involves what is sore throat is, or what are the symptoms, or what are the difficulties when a patient is having sore throat. That is pain on swallowing when we are ingesting something, okay, or swelling. So there is a sense of pain. Second one is inspect throat for redness and white patches. White patches are present, they indicate diphtheria. So that is the main sign for diphtheria. If the sore throat is present and white patches are also present. Okay, so that is the indicative of diphtheria. Next is take throat swab if necessary and facilities exist, and send the sample to the lab. So if we have to confirm the diphtheria, then we have to take the sample and send it to the lab for the confirmation. Next, if there is whitish gray coating and difficulty in breathing in children, these are the signs of diphtheria. So if sore throat is present, see, in each and every minor ailment, if the symptoms are mild, then these are the minor ailments. But if they are accompanying with some of the chronic symptoms, then they are associated with one or two or more. We can say that the chronic disease, like in the sore throat, it is associated. It can be associated with the diphtheria. Next is to check the vital signs. So we have to check the vital signs. Okay, advise saline gargles so that we can relieve the pain of the throat. If fever is present, give antibiotics. Advise bed rest and adequate fluids. Advise syrup of the honey with lemon juice and hot water, because it will provide comfort to the throat, and the other if there is restlessness or some of the irritation in the throat is present, so it will reveal that. And last point is, in case of recurrent tonsillitis, refer to the hospital. Okay, so if in case there is the presence of the tonsillitis, immediately refer to the patient to the hospital. Okay, so that was all about the today's topic, that is minor ailments, its introduction, and standing orders. What are the standing orders? So these are the standing orders that I am explaining you about the different minor ailments. Okay, so that was about the today's topic, that is minor ailments part 1. In the next week, I will explain you about the other type of minor ailments. So it will take 2 to 3 videos, I think, to complete this topic, because it is a big one. Okay, so keep in touch with me. I will meet you in next week. Okay, with the minor ailments part 2. Okay, so thank you everyone. We will meet in the next week. Thank you.